Have you ever wondered why urinary tract infections, or UTIs, are so common, and what exactly causes them? These infections are a prevalent health issue that affect millions worldwide every year. Understanding UTIs, their causes and consequences is crucial in combating this common affliction. It's not just about knowing the medical jargon, but about gaining insights into our body's complex systems and how they can sometimes go awry. By the end of this video, you'll have answers to all these questions and more. So, what exactly is a urinary tract infection? Essentially, it's an infection in any part of your urinary system, which includes your kidneys, bladder, ureters, and urethra. This system plays a crucial role in our body, ridding it of waste products and excess water via urine. Most often, UTIs are bacterial infections that begin in the lower urinary tract, which consists of the bladder and the urethra. But how does an infection take place? Well, bacteria from the bowel live on the skin near the rectum or in the vagina, which is close to the urethra. These bacteria can move from the urethra into the bladder, where they can grow and multiply, causing an infection. If the infection isn't treated promptly, it can travel to the kidneys and lead to more serious health issues. Now that we know what a UTI is, let's delve into the causes. Many factors can contribute to the development of a UTI. But what exactly are these factors? Well, let's break it down. Firstly, you need to know that UTIs are primarily caused by microorganisms such as bacteria, viruses, and fungi. The most common culprit is a type of bacteria known as E. coli, which usually lives harmlessly in your gut. However, if these bacteria make their way into the urinary tract, they can multiply and lead to an infection. Viruses and fungi are less common causes, but they can also lead to UTIs, especially in individuals with weakened immune systems. For instance, the herpes simplex virus can cause UTIs, and certain types of fungi can cause yeast infections in the urinary tract. Now let's talk about risk factors. The structure of the urinary tract plays a significant role in the development of UTIs. In women, the short distance from the anus to the urethra increases the risk of bacteria moving into the urinary tract. This anatomical structure is one reason why women are more likely to experience UTIs than men. Sexual activity can also increase the risk of UTIs, as it can introduce bacteria into the urinary tract. It's not about how much sex you're having, but rather, the physical act itself can move bacteria into the urethra. Blockages in the urinary tract, such as those caused by kidney stones or an enlarged prostate, can also contribute to UTIs. These blockages can slow the flow of urine and give bacteria more time to grow. Lastly, a suppressed immune system can increase the risk of UTIs. Conditions that suppress the immune system, like diabetes or HIV, can make it harder for the body to fight off infections, including those in the urinary tract. Understanding these causes is critical, but recognizing the effects and symptoms is equally important. So stay tuned as we delve into the effects and symptoms of UTIs in our next segment. What happens when you have a UTI, and how can you tell if you have one? When a urinary tract infection, or UTI, sets in, it primarily affects your urinary system, which includes your kidneys, bladder, ureters, and urethra. The infection usually starts in the lower urinary tract, where the bladder and urethra are located. If left untreated, it can move up to the kidneys, often resulting in more severe symptoms and complications. One of the earliest and most common symptoms of a UTI is a strong, frequent urge to urinate. You might find yourself rushing to the bathroom more often than usual, only to pass small amounts of urine each time. This happens because the infection irritates the walls of your bladder, making it feel full, even when it's not. Another telltale sign of a UTI is a burning sensation or discomfort when urinating. This is due to the inflammation and irritation caused by the bacteria in the urinary tract. The urine might also appear cloudy or have a strong, unpleasant smell, indicating the presence of bacteria or pus in the urine. As the infection progresses, you might experience pain or pressure in your lower abdomen or back. This could be a sign that the infection has reached your kidneys, especially if it's accompanied by symptoms such as fever, chills, and nausea. In some cases, a UTI might cause confusion or mental changes, particularly in older adults. This often overlooked symptom can be a key indicator of a severe UTI that requires immediate medical attention. While these symptoms can be quite uncomfortable, they're crucial in helping to identify a UTI. It's important to note that not everyone with a UTI will experience all of these symptoms, and some might not experience any symptoms at all. This is especially common among older adults and people with a compromised immune system. So it's crucial to listen to your body and seek medical advice if you suspect a UTI. Even seemingly mild symptoms can quickly escalate if left untreated. Recognizing these symptoms early can lead to quicker diagnosis and treatment. So, you suspect you have a UTI, what next? Let's delve into the treatment options available. A urinary tract infection, or UTI, is typically caused by bacteria. So, the first course of action is usually antibiotics. These are prescribed by a healthcare professional after a urine test confirms the presence of a UTI. The type and length of antibiotic treatment can vary depending on the individual's health condition and the type of bacteria causing the infection. It's crucial to complete the full course of antibiotics, even if symptoms improve before the medication is finished, to ensure the infection is completely eradicated. Now, while antibiotics do their job, you might need something for the discomfort. Over-the-counter pain relievers can help alleviate UTI symptoms such as a burning sensation during urination or lower abdominal pain. However, it's important to remember that these medications are just for symptom relief and do not treat the underlying infection. In addition to medical treatments, there are also home remedies that can complement these approaches. Drinking plenty of water is recommended to help flush out the bacteria from the urinary system. Avoiding irritants like coffee, alcohol, and spicy foods can also give your bladder a break and promote healing. Some people find relief in using a heating pad on the lower abdomen to soothe pain. That said, prevention is always better than cure. There are several measures you can take to prevent UTIs. Keeping well hydrated and urinating regularly can help flush bacteria out of the urinary tract, reducing the risk of infection. Peeing before and after sexual activity can also help prevent UTIs by removing bacteria that might have entered the urethra. And of course, maintaining good personal hygiene is always beneficial. In conclusion, treatment for UTIs typically involves antibiotics, pain relief, and home remedies. But remember, if you suspect a UTI, it's always best to consult a healthcare professional for appropriate treatment. Getting appropriate treatment promptly can help prevent complications and ensure a quick recovery. UTIs are common, but that doesn't mean they should be taken lightly. So let's recap what we've learned today. Urinary tract infections, or UTIs, are infections that affect any part of your urinary system. They're often caused by bacteria entering the urinary tract through the urethra and multiplying in the bladder. UTIs can impact anyone, but they're more common in people with a female anatomy due to the shorter length of their urethra. Risk factors include sexual activity, certain types of birth control, menopause, and conditions that obstruct urine flow. The symptoms of UTIs are not to be ignored. They might include a persistent urge to urinate, a burning sensation during urination, strong-smelling urine, and lower abdominal pain. In some cases, the infection might also cause fever and back pain, signaling that it has reached the kidneys. Treatment for UTIs typically involves antibiotics to kill the bacteria causing the infection. Drinking plenty of fluids and avoiding irritants like caffeine can also help. However, it's crucial to remember that if symptoms persist after treatment, you should seek medical advice. UTIs can lead to serious complications if left untreated, including kidney damage. In conclusion, understanding UTIs, their causes, effects, symptoms, and treatments is essential. It's not just about curing an infection, it's about preserving the health of your urinary system. With this knowledge, you'll be better equipped to understand and deal with UTIs. Remember, health is wealth.